Hello future doctors, how are you all? Welcome back to MedSteps YouTube channel. So today in this video we are discussing about very high yield topic in general pathology from first aid guide. Okay, so the science behind scar formation and how to differentiate cleared versus hypertrophic scars, and we are going to discuss little amount of lipofuscin, the aging pigment. Okay, so first scar formation. Let's get started. When tissue repair cannot be achieved by regeneration alone, the body switches to scar formation. That happens when the injury is too severe or the tissue is non-regenerative. Then we can see this type of conditions. Okay, it occurs when repairs cannot be accomplished by cell regeneration alone and non-regenerating cells secondary to severe acute or chronic injuries. What replaces the damaged cells? First one, connective tissue. Okay, this connective tissue and 70 to 80% of tensile strength, and another thing primarily collagen. Okay, so this connective tissue 70 to 80% of tensile strength regained at 3 months, little tensile strength regained thereafter, associated with excess TGF beta, okay, like transforming growth factor beta. So in scar formation, mostly what are the things you have to know, you must have to know means this by 3 months the scar regains 70 to 80% of its tensile strength. After that, very little additional strength is gained. The whole process is regulating by transforming growth factor beta. So if you are asked what cytokine is key for fibrosis and scar formation, the answer will be TGF beta, means transforming growth factor beta. This is very important point, that is why I am focusing more. Okay. Next one, types of scars. If you are seeing this image, you can see here, this is the first one, hypertrophic scar, and second one, this one, cleared scar. Okay. Now we are going to differentiate these things. Let us break it down. The two major types of pathological scars. First one, hypertrophic. In this hypertrophic scar, you can see here first collagen will be in hypertrophic scar, the type 3 collagen will increase and the collagen pattern, we can see that thing will be parallel, and the extent of scar, it stays within wound borders, and we can see appearance like raised red film. You can see this image like this. Okay. Next, the recurrence will be infrequent and predisposition will be no specific groups, and common site will be any wound site. This hypertrophic scar we can see after the wound. Okay. Next one, cleared. This cleared scar, in collagen we can see that type 1 and 3 collagen will increase in cleared scar, and collagen pattern will be disorganized like episode like this. It is a disorganized cleared scar formation. Okay. And the extent will be the grows, extent of scar will be like grows beyond the wound borders, and the appearance will be like this, claw like thick, may sometimes it will itch and it will pain, like that this appearance will be. In recurrence, it will be like frequent, and predisposition will be higher in individuals with darker skin, like darker skin people like melanin. Okay. And common site will be earlobes like this, you can see here this earlobes, and face, okay, and shoulders and chest. In the scar is raised and extends beyond the wound, thick cleared. Okay. In exam point of view, if any question they are asking, like if the scar is raised and extends beyond the wound, then we have to think about thick, we have to think cleared. If it is raised but confined, thick, confined means we have to think about hypertrophic. Okay. So next, lipofuscin. What is lipofuscin? Let's talk about the classic microscopic finding in aging cells. Lipofuscin, also known as aging cells. What is it? What importance we have to discuss means a yellow brown wear and tear pigment seen in elderly patients. So we can say these things in the yellow brown or wear and tear pigment you can see in elderly patients. How is it formed? It through oxidation and polymerization of autophagocytosed organellar membranes. Okay. This is formed by oxidation and polymerization and autophagocytosed organellar membrane. Okay. Where is it found? It is seen in aging organs like heart, colon, liver, kidney and eyes and other organs, even eyes also. So, what is the main important clinical relevance means? It is harmless and non-pathological, but shows up to in autopsies as a marker of cellular aging. Okay, it is very easy. Lipo means fat, fusin means brown. Brown fat pigment of aging is known as lipofuscin. Simple. Okay. So, let us take some recap. Scar formation happens when regeneration is not enough. Transforming growth factor beta is the main cytokine driving fibrosis. Hypertrophic, within borders we can see, cleared beyond the borders we can see. Lipofuscin, normal aging pigment, not dangerous. All of these are tested concepts in USMLE and NEET PG and FMGE. So, thanks for watching. If this video is helped clarify this important pathology concepts, give this video a thumbs up and subscribe for more high yield breakdown. In the next episode, we will explore. In the next episode, we are going to discuss about amyloidosis. Okay, so if you have any doubts, you can ask me in comment section. Take care. Bye bye.